Thank you to those that came today. We will get started now and hopefully be able to get you guys out of here a little early before the plenary, which I'm sure everybody always enjoys to get out early. All right, as you can see, this is our disclosure slide. And presenter disclosures and agenda. We're going to have a panel of speakers today with opportunities for question and answer and discussion throughout the session. So we'll do it after each speaker. And so joining us today, we're going to have 3 accomplished speakers here to provide insight on how to establish, improve, and nurture collaboration in CF clinical research. Rachel Rich is here to discuss exploring and utilizing regional cooperatives. Steph Hansen will speak about their experiences in clinical research. And Salma Moreno will help us navigate resources that optimize site collaboration. Our objectives today include describing what the Regional Cooperative is, its value to sites, and how it meets the missions of the Foundation. We're also going to discuss potential research participant referrals from the patient's point of view, and examine the experiences of a newer research coordinator navigating site collaborations. So I'm now going to hand the mic over to Alex Wilson to speak more about site collaboration.
Okay, so again, thanks to those of you that are here. We really do appreciate your time and attention. So I wanted to take a few minutes to discuss why RC collaboration is so important to meet the needs of people with CF and the mission of both the CF Foundation and the TDN. So first, the mission of the CF Foundation is this: to cure cystic fibrosis and to provide all people with CF the opportunity to lead long, fulfilling lives by funding research and drug development, partnering with the CF community, and advancing high-quality specialized care. So if it isn't obvious from plenaries and other sessions that we've been to, we're definitely a mission-driven team. This mission is found on cff.org website, along with these statements. That the CF Foundation is made up of a group of scientists, caregivers, donors, volunteers, and people with CF and their families who are united by a common goal, the mission of the Foundation. And the Foundation is also driven by a dream that one day not one person will lose a life, child, sibling, parent, or friend to CF, and they are determined to succeed. So again, the Foundation has a goal, and to reach this goal, research teams really need to work together. And actually, our research team is also very mission-driven. I meant to say that when I started. And one of my first conversations that I have with people when they are interviewing or for a position on my team is to state that we are a mission-driven team. And I'll usually go through these missions with them at some point, but the studies that we choose to participate in at our site are directly related to these missions as well. So there is a TDN mission too, and you can find these on CFCRNet in the Manual of Operations, or I'm guessing probably on the hub at some point too. So I'll look for it there. So the mission of the TDN is to facilitate the clinical study of new and existing therapies to cure and control cystic fibrosis. But with that mission, they also have 7 goals to help meet this. So I'm going to go through all of them and highlighting these keywords here, which I think really relate to our collaboration. So number 1 goal is to protect the safety and rights of individuals with CF involved in clinical research and provide access to CF clinical trials. To optimize the benefits of clinical research for the CF community by partnering with industry and centralizing the process for review and prioritization of CF clinical studies. Again, partnering with industry isn't necessarily what we need to do to collaborate as RCs, but the partnering is really key right there. The next 2 don't really relate as much to us as RCs, but I want to read all 7 goals. To utilize archived data and specimens to perform innovative ancillary studies and expand the scope of scientific inquiry. To maintain centralized expertise in CF study design, specialized clinical trial procedures, and analysis and interpretation of specialized data. The next 3 certainly relate to us and our session. to optimize current CF research outcome measures by improving existing methodologies. And some of these methodologies are to develop new biomarkers, to facilitate the assessment of biologic activity, but improving existing methodologies, I think also for us includes how we can get these studies accomplished. To make efficient use of limited resources by practicing continuous quality improvement and sharing best practices for clinical research. And back on the limited resources include people with CF who may qualify for more complicated clinical trials that sites are able to carry, how we're able to carry these trials out. And us, as medical research teams and coordinators, need to make use of those limited resources too. And last, to promote the continued advancement of quality CF research by facilitating the training and mentoring of new clinical research staff. So to reach these goals, we need to remember what makes the CF community. These include people with CF, their family, friends, caregivers, and the clinical care teams, and also the clinical research team. So to bring research to all people with CF to meet the goals of the Foundation and TDN, we must partner, improve our existing methodologies, make efficient use of limited resources, share our best practices with each other, and continue to advance quality research by collaborating with each other and to take advantage of training and mentoring opportunities available. So that's what we are here to talk about today. So we're also going to be discussing how to collaborate with each other and how we can make, again, CF research possible at our own sites, and that collaboration will eventually help all people with CF live longer, healthier lives. Okay, I'm going to introduce our goal for our session is to promote collaboration across sites, sorry. I'm going to introduce our first panelist. So Rachel comes to us from the University of Alabama at Birmingham. Rachel Rich is an experienced clinical coordinator 3 and has been in research for 7 years, and 2 of those years in CF. She has been instrumental in genetic therapy referrals and enrollment, along with enhancing collaboration among our CF centers. In addition to her role at UAB, Rachel is also involved with our CF Alabama chapter and fundraising efforts. While Rachel isn't at work, she is at the ballpark watching her kids play sports, me too, from softball, baseball, football, and cheer. Rachel has joined us today to talk about exploring and utilizing regional cooperatives. Let's come on up, Rachel.
Watch me breathe. Okay. I promise I'm not a public speaker. I'm much better at one-on-one conversations, so bear with me. Okay. So I know we've heard about like the collaborations and cooperative groups and all our centers and working together in the plenary. So I kind of just want to dive deeper into what the collaboration is and how I kind of help run ours. So first, what is the Regional Collaborative and why was there a need to start this networking? The TDN led the collaboration by sectioning off the US into different regional groups. There are 20 in total that are led by a principal investigator and a research coordinator. I help lead the Southeast region that's shown in dark purple or blue, it looks blue here, with Dr. Miles Fowler. This encouraged collaboration has been in motion for 2 years now. Now that you have the what, let's go into our why. Our studies are constantly changing. We used to have modulator studies that would accrue 20 plus patients at one center, and we're just not in that realm of research anymore. I mean, we still have those high enrolling studies, but now we have to focus on all the gene therapies. So this, with the research changing and to capture that last 10% of patients that are not modulator eligible or unable to tolerate modulators, we need to collaborate together because we need to help from other centers and to find that 10% so no one's left behind. So here's our Southeast region, or CIRC as we call it. We're making shirts. We try and keep it fun. Anyway, so there are 14 centers that are in our region, and those are the states that are listed there. And we have other MDs and PIs that, or research coordinators that join. So you don't have to just be in one group. You can collaborate with the whole region. Everyone wants to be friends. Let's all be friends. All right, so this is how we run our meetings. It's not a one-size-fits-all, but this is what works for us. Currently, our Southeast regional calls are scheduled monthly. It's the second Thursday of the month at 11 Central Time. My goal is to catch at least one representative from each of the CF centers, and that each information that's covered, I send out, hopefully, I send up a follow-up email with the information that we covered on that month's Zoom call. So these are things that we've had on them. So like we just had the PEP genetic therapy training in September, which was phenomenal. We do study spotlights, so each of the different centers, if they're doing a new study and it's open to enrollment, I invite them to come and talk and share and go through eligibility and like kind of study timelines so we know and get patients listed to who can go to that center. We've also had different study spotlights and QI projects that are covered. If they had an equip thing that they did, why not learn from each other and see, okay, if it worked for their area, let's bring it to ours. And then for next month, we're going to be doing the research hub, which I know you guys, we've heard a lot about during this time. All right, so as I said, there's always room for improvement in our meetings. And this is one way that I tried kind of see constructive criticism where we were. So this is the email I sent out to our region, which after 2 years of doing this meeting, we kind of wanted to see what are we doing well, do we need to fix, what can we improve. So I sent it out to, in our region, there's about 110 people that I sent it to. And so this survey had some of the questions like, what is your role within the care center? Do you participate in the regional monthly calls? If you do, why or why not? What resources can the CFTDN help bring to our center and help with research referrals? When does your center start the conversation involving genetic therapies? And do you feel comfortable making a referral to other CF centers? I wanted to see, are we okay? Is the networking like helping? Can we do RC to RC and help with patient referrals? And then do you think the lead site role should rotate? So we received about 40 responses that encouraged the gene therapy pep talk that we just had. And we will continue to have study spotlights highlighting the current NABT trials and what's open to enrollment and what's coming up next. Thankfully, they don't want to kick us out, but there is room for improvement, so we're trying to work through what the responses were. And I keep saying this all week, but I always say, like, we want to have phone a friend. So, like, who's your phone a friend? If you have a question or you need a referral, or if another site is doing the study and you're just getting it open, why not have that person to call? So I try and have as many phone a friends as we can. So this is our list of who is invited. One of my main missions with sending out that survey was to find out who is aware of the Southeast regional calls, who's paying attention to the emails, who knows their CF patients, and who's not on this list that needs to be invited. The TDN has a spreadsheet that they set up for us that has the main players for each of the centers, but how many of those personnel regularly attend the meeting and who knows what's actually current and what's going on. For example, I'll use my center. Our research team covers both adults and peds, and I know not every center has that, but that's how ours works. Our pediatric side has about 300 patients along with our adult side. So it's a lot of patients to cover. So who do I need to invite from my group to ensure that the information is getting to our clinic staff? If my CF clinic directors aren't attending, I need to make sure that information is getting out there. And I get that doctors are busy and they don't always have time to do it, but we at least need someone represented from each of the teams so that they have that information. Okay. Sorry. We recently added a separate call that is just for program coordinators and research coordinators for the region. This allows us to go more in depth on eligibility for our NABT trials, along with any other clinical trials that are recently activated. The RCPC call can pull the SMART report list within my CFF, and then we can review them together. There's something about RCs and PECs talking without the MDs all being on there. Not that we don't need them, but it just open communication. It allows, more question answers. How can we help navigate? Katie Howe is also invited to those, so she's available to help with any referral questions. And then Rochelle's also there from the TDN in case there's any information that's needed on her behalf. All right. And then I don't know if anyone else watches New Amsterdam, but my favorite part about that show is he constantly in front of his team is like, how can I help? So that's my main goal and this is what I love, is RCs helping other RCs getting patients enrolled. And then why do we need to collaborate? Continuous communication, get those phone of friends, develop relationships. The easier that we are able to communicate between each other, our patients benefit. If we have studies that are available for them, if the information's out there, the communication between them gets, it just helps with our patients. It just helps our patients find that information, and then to already have that RC that you can call and say, hey, I know your site's enrolling. I have a patient for you. That's it. How can I help? Questions? I move my hands too much.
Does anybody have any questions? You can come right up or put it into the chat.
Oh, Sue.
So our center, I'm kind of like an imposter here. We're not in that regional area. We're in another regional area, but I can tell you this referral process, this people talking with one another, has benefited our patients exceptionally. So you're the best. I'd love to send all my patients to you, but it's just a great resource to have this open communication.
Good. Awesome. Sue's one of my phone of friends. Thank you.
I have a question for you.
Yeah, we have questions.
Okay.
So you don't get off that easy. So if I am a newer coordinator, and let's say I, came onto a team where a more experienced coordinator had left or something like that, and, I'm new and I don't know much, how can I figure out what region I belong to, and how do I find out how to contact somebody to, join and find out when these meetings are going on?
So the Research Hub, which is live now, which wasn't when I made the PowerPoint, but on there's a map, and you can hover over it and see what region you belong to, and the contact information would be there. So that's how you find out what region. And if you need help, I can help too.
Yeah. Is everybody familiar with where to find the hub?
My CFF.
my.cff.org. Yeah. So I have a question about that PEP genetic therapy training. Did the region do it, or did you do it with your team? How did that work?
So Dr. Lynn Quintel and Cindy George came. It's one that they offer, and I did it for our region. So they came and presented on our Zoom. And it was great because it was in my notes, but I talk fast.
It's okay.
But one of the things that I loved about it, it was PEP specific for gene therapy.
Yeah.
But my key takeaway was we're not waiting till they're almost 18 because that's when they're eligible for it. Like, we're starting the conversation in pediatrics. It's another tool available in our toolbox and it's not just for the 10%, where you need to start this conversation with all of them, because this would eventually be the cure. And so we should be talking about to all our patients regarding gene therapy. So it was very helpful. And they do it, I think they've done it in 13 of the regional sites on their collaborative calls, but highly recommend.
I think that I would like to do that.
That's great to know. I didn't know about that.
Yeah.
Oh yeah, and they send handouts and they do a questionnaire beforehand to kind of see where everyone is, and then follow up to see how you feel about it post.
Cool. So glad you
PEP.
mentioned it.
Yes.
Go ahead.
So with the Regional Cooperative, is it just the research team, or can social workers or any other clinicians on the CF team join in?
It is open to anyone. So our center is big, and it lists, your clinic director, your TDN director, your lead research coordinator, but it is open to all of them. Like I invite our nurse practitioner to it because she's the one that I send, hey, I have this study opening. Here's key eligibility. And she'll send me, here, let's talk to this one, this one, this one, this one. So she knows the patients. So she's kind of like my honey-do list I sent to her. Same with like our pediatric coordinator. Like if you know like your social worker knows the patients well, they can come to it. It just helps getting that information out there, and it's open to anyone.
Thank you. Does anyone else have any questions? I don't think there's any in the app, but feel free, small group.
Or like I said, I'm better at one-on-one, so we can talk later.
Yeah. Thank you, Rachel.
Thank you.
So thank you so much, Rachel. It's now my pleasure to introduce our next speaker, Steph Hansen. Steph is a 2024 National CFF Peer-to-Peer Ambassador, a member of the CFF Adult Advisory Council, and a patient advocate hailing from Texas. Steph has graciously agreed to join us today to speak about their experiences as a research patient outside of their home center. So please welcome Steph.
Yes, it's right here.
Of course.
Hey, good afternoon. What is this thing? I don't know. Okay, I'm going to just do that. So my name is Steph Hansen. I had the privilege of working with Boston Children's Hospital on a study for the better part of a year. Excuse me. Technically self-referred to BCH, and because at the time there was no study sites in my part of the country. And this was a huge decision for me to travel to Boston from San Antonio, Texas. You know, there was lots of reasons why it was a big decision. I had never participated in research before. I'd have to get on a plane for the very first time since the start of COVID, which felt really, really scary to me. I'd be away from my normal CF team and my normal support system. Not to mention, I'd never been to Boston before, so I had no idea about this part of the country. After the first month or so of communication with BCH, Julia became my main point of contact, and it stayed that way throughout my participation in the study. Now, I knew that participating in a study at a site that I'd never been seen at before might require a lot of back and forth and like a lot of exchange of information. But so I was ready to do whatever I could. In the early days of the exchange of that information, I was obsessed with checking my email to make sure that if Julia or somebody from BCH was emailing me with questions or needing approval for something, that I could help them. And I was ready to do anything I could. I'd not had medical records sent anywhere for many years. And so I was ready to like walk down to my hospital and like fill out the little form and then get the huge honking medical records and FedEx them, you know, like in the olden days. I didn't know how those things work. So, but I never ended up needing to do that because I have an awesome nurse at my clinic named Melissa, and her and Julia, their communication was really seamless. I just got to sit back and kind of eat Oreos. But while I waited, I got regular updates from Melissa. She'd call me and say, hey, BCH, they requested X, Y, and Z. I'm going to send it off today. I'd be like, all right, cool, yeah. And then I get emails from Julia, and she'd be like, hey, we received X, Y, and Z today, and we're reviewing it, or this is where we're at with the sponsor. So I was always really well informed along the way. And it was a bit of a wait. It was a couple months, so it was nice to be informed. You know, I think as a CF patient, I'm really used to having to ask a lot of questions and advocate for myself a lot, especially when I'm working with new teams. But during this process, Julia took that burden off my shoulders pretty immediately. Before we met, she was anticipating my needs and advocating on my behalf to the sponsor. Without me asking, she requested direct flights, only direct flights being booked from where I was to Boston, which was a huge weight off of my shoulder. She also had a list of hotels that the sponsor was likely to cover for me. So I wasn't burdened with the task of saying like, okay, where should I stay? And, you know, where is it going to be easy to walk to? And what's going to feel safe for me? And when one of those hotels didn't work out for me, she suggested another one nearby. She heard my concerns as somebody who was still very COVID conscious and helped make travel feel as safe and comfortable for me as possible. As a newbie to research, I'd never done research before, and I didn't always know the right questions to be asking. So I was grateful to work with a team who could recognize that inexperience and do a whole lot of hand-holding along the way. I was like a little lost puppy. When Julia sat me down at screening and went through all the details of the study, I was really shocked to realize that I had not read through the informed consent as carefully as I thought. I read that thing like 4 times, and I ended up missing a lot of really important details. So she took the time to educate me, answer questions I didn't even realize that I should be asking. And from that meeting, I knew that I could have thoughtful discussions with her and the team and really tease out those important questions that might come up along the way. Anything from safety concerns to where I could find the best lobster roll in Boston. And if you're wondering, the answer to that question is Salty Girl off of Newberry Street, if you want to grab one before you leave. But, I look back on my experience through this study, sort of like I was just along for the ride. So much was taken care of for me that oftentimes I felt like all I had to do was show up to the airport on time and show up to BCH on time. Well, all of that really took effort on my part. I'm not trying to minimize that. The planning, the execution, the communication that Julie did on the front end that really minimized the demand on both my mind and my body, especially as things went on and I got more familiar with the flow of how things went during the study. I was always really well informed before anything happened, which was very nice. Nothing ever surprised me. Communication was always seamless, and when I did have questions, they were always at least acknowledged, if not answered and taken care of same day, which was nice because we were in 2 separate parts of the country with time differences and everything. As an example, after arriving home from screening, I was exhausted with the quick turnaround, and I felt like my body needed just a little bit more time as a buffer to adjust to traveling. I went home and I slept for like 16 hours, which is so not like me. It took a lot out of me to travel. Now, I wasn't sure if it was appropriate to ask for extra things based on my own individual needs. I thought it was like, the sponsor's gonna cover, but the sponsor's gonna cover, and you don't get anything else. But because Julia had advocated for those direct flights, I was like, okay, maybe she's a safe person to ask. So when I did ask her, it took her like a day to communicate with the sponsor and get the approval for those extra days on my shorter visits to Boston. Now that built trust and opened up a door for me to be able to freely communicate my needs throughout our time working together. And even when she was unsure whether the sponsor would cover an expense or reimburse me for something, her answer to me was always, well, we'll ask or we'll submit and see what they say. And we were pleasantly surprised, like more than once. Mm-hmm. When we first met, she often told me that the hardest part about CF research could be getting people with CF to stay stable throughout the process. And when this came to be true to me due to medical emergencies, pushing back visits, I was grateful that she had warned me that this might happen because from my perspective, I felt like my body and I were throwing wrenches in everything. And I was like, oh my God, Julia, what are we gonna do? But through any of the hiccups, she was always really patient with me. And it was that kindness and understanding that allowed me to kind of push through my internal dialogue of I am the most painful patient to work with, and they're never going to want to work with me again ever in my whole life. So if I ever inconvenienced her, she never let me see it, and she never let me see when things weren't going, see her sweat when things weren't going according to plan. In fact, one of my favorite memories from this study was the result of her making a slightly annoying situation into a really fun one. Well, she told me that for my next visit, my normal hotel was sold out. And so I had just told her that morning in clinic, I was really disappointed I didn't get to go to Harvard and explore. And so her solution to the problem was finding me a hotel in Harvard Square that the sponsor would cover. And so the next visit, I got to come back and explore Harvard. And the Uber ride to BCH was a little bit longer that time, but I didn't care because I had a blast. So whether it's intentional or not, one of the things I really appreciated about working with the team at BCH was their openness and their ability to connect with me as a patient, not just as a patient, but as a human. Everyone I had interacted with before I met them via email and over the phone was very, very nice, but there's always a little bit of apprehension as a queer person who's traveling to new sites. I never know if that's going to impact my care or how I'm treated. But during my initial visit at the pulmonary clinic, where I saw people wearing rainbow BCH pride lanyards, and that immediately put me at ease. I think as a patient, you're expected to share a lot of your life with clinicians. You guys like go through my medical records, you know where I live, you know some of the most important people in my life because they come with me to appointments. But I was grateful to work with a team who were easy to connect with and opened up with me a bit, so that relationship didn't feel so one-sided while I was so far away from home. When I made trips to Boston on my own without support, I didn't feel alone while I was away from my normal support system because of the relationship and the trust that was developed with the team. I felt confident and comfortable to reach out to them at any time. And as months passed by, it was cool to kind of be like, hey, like, how's your family doing? Or what books have you been reading? Did you take that vacation? It's an openness that's not always reciprocated by clinicians, and so it meant a lot that they were able to connect with me in that way. It made being away from home and being in really vulnerable situations by myself so much easier. It really created that home away from home sort of feeling. So in the beginning, I had no idea really what I was stepping into. I was just like happy-go-lucky, like, let's do this. But working with a coordinator like Julia and a team at the one at BCH to lean on, it created a place for me where I could feel safe and looked after and have a bit of fun while we were at it. I had a great time. Would do it again.
All right, thank you. Does anybody have some questions for Steph?
Steph, thanks for being here.
Yeah.
It's always appreciated to hear from patients. I find that to be some of the most vulnerable and beautiful stories that we get the privilege to hear. So thank you. My question is, and I think maybe this is also for Julia too, and maybe I missed this, but when it came to, obtaining medical history or any medical records, I know that you said that was taken care between your site and Julia, but did you have to sign a release of information, or did your institution have privileges that allowed you to get that information?
No, so as soon as Steph had reached out to us, like she said she had self-referred, we got a bidirectional authorization signed. It's one of the very, very first things that we do. And so then that kind of goes the life of the study. So that kind of took care of all of that.
Yeah, I just remember signing one thing and then it was just like, I didn't have to do anything.
Hi, Steph.
Hey.
So I'm just curious, what was your motivation to have your first research study be not at your center, not in a city that you're even familiar with a team that you don't know? Usually, it's start with a little, observational study, single visit, and you sounds like you went full in at your first time. So what was that motivation?
Yeah, it was a deep dive for sure. Yeah, so I'm part of the 10% of those, CF patients. I can't take any modulators, and to be totally honest with you guys, I'm pretty desperate for more options. And so participating in research seemed like something that would sort of counteract the sort of powerlessness that I feel over being part of the 10%. I don't live near a large research center. The nearest one to me, I think, is about 5 hours. And at the time, there were only 2 centers or study sites for the study open in the country. And I was like, well, I've always wanted to go to Boston, so let's go to Boston. And that's how I ended up at BCH. But it was a study that's really excited me, and that's why I chose this one, even though I had no experience at all.
All right, well, we got a couple questions for you.
All right.
Can't let you off that easy. So what was the most helpful thing that your site or the study site or the sponsor did that made you most at ease with completing a challenging trial like this away from your home center?
Yeah, well, I have to mention the sponsor was much more flexible than I realized they would be and provided more for me than I realized. I was grateful that, as time went on and I realized oh man, I need a little bit more of this or that. And they were always kind of open to giving me more. And then additionally, I think as far as the study site goes, you were super responsive. Like I was here on a holiday weekend by myself in Boston, and like I was reaching out on a holiday weekend, and I never had to wait long to hear back from Julia or any of the team. And that was always a great comfort and really valuable to me as a patient, because again, like there were times it felt really lonely, and like there were things that happened along the way during the study that I was like, oh gosh, like, do I need to go to the emergency room? Like, stuff is happening. And knowing that I had a great team, multiple people to fall back on and reach out to, and I knew they'd be responsive, that was extremely comforting and very valuable to me as a patient.
I have a question for you. So you mentioned, oh, sorry, go ahead. You first.
Thanks. This is I'm John from Boston, one of the PIs at Boston. And first, thank you for sharing this your journey through the research with us. And this is the first time I'm hearing it. The question I have for you, as somebody who provides care as well as research, is before you embarked on coming, did you work out sort of like who would be responsible for if clinical issues came up outside of research, how would those be managed? Where, if you were in Boston or if you were back home, or was that something that came on the fly, or how did you manage those?
I am so new to research. I didn't even think about it. But I will say pretty early on in the study, I realized oh, I'm here alone and I don't have support. So there was one point I asked Julia, I was like, okay, if I fall and break my leg, if something happens, where can I go that they're gonna know CF, they're gonna be able to really take care of me. And she gave me a direct number to a physician, and from then on, I was like, all right, this is how I take care of things if anything pops up. So I learned the lesson along the way. I didn't really consider it on the front end. It's definitely something I will consider in the future. But as a newbie, I failed to kind of think about that. That was a big lesson for me along the way, was thinking about my future self and, asking the questions that might come up along the way. And so, yeah, thanks.
Okay, thank you. So my question is about the consent process. And because you mentioned you read it several times, and then you and Julia had the conversation. So it's kind of a two-part question. First for you, and then I'll follow up with you, Julia. But what are some of the pieces of advice that you would tell someone else looking at a consent form to cue into, to know what questions to ask a research coordinator before you decide to fly there or something,
Yeah. I think that I read it and I was just so excited about the potential of this study that my excitement got the better of me. And so there may have been parts that I thought I read, but I kind of skimmed over that, in addition to there were parts that I think maybe I didn't understand, but I was like, that's okay, whatever. Yeah. And so now I know if I'm reading through an informed consent, I'm underlining things, I'm highlighting things, and then I'm scheduling a call with the research coordinator to ask those questions. And again, thinking about my future self, if something's not mentioned in there, or if I don't see it, being sure to ask those questions, but asking lots and lots of questions. I think that I was maybe afraid to. I feel like maybe I didn't want to seem dumb or show my inexperience, but now anytime I'm looking at any sort of study, I have an ongoing list of questions for whoever it is I'm talking to.
That's good. And then Julia, what are some of the things that you did to make the consent process be longer or shorter? What are some of the questions you ask and things like that, so that you are partnering then with the person that is choosing to enroll in the study?
So what I typically do is when I have a new patient that's looking at a study and I know that we're coming up to do an informed consent, I first send it to them via email and I say, please try to look over this, come up with some questions. I'd say I'm 50-50 on patients that actually do open up that document and look at it. But then I really do go through the whole entire thing and it's long. And for like this trial, like I give myself like an hour and a half at least to do the informed consent, like at a minimum, because we really have to go through every part of it. And I try not to read it verbatim, but I do try to go through each part and kind of talk about it and like make sure that there's understanding, and that the patient's able to verbalize understanding back as we kind of have more of like a discussion about each part of it. And these consents are, 25, 30 pages long. So they do take time and it's not something that we tread on lightly. And then even when we get to the end of it, still, go back through those questions. Okay, do you feel like you had enough time? Do you have any questions? Are there questions that I didn't answer that, that I need to bring somebody else in, the PI typically, and in this case, this was done over Zoom. So the PI was on the call and was able to answer anything that was maybe out of my scope of knowledge. So we really take our time with it, and it's not something that's just another assessment done. We put a lot of thought and effort into it because this is a big deal, and I really don't want to be responsible for somebody joining a study and then realizing that they didn't really get the scope of it and that they didn't want to be in it. Like that, I would feel horrible. So I want to make sure you knew what you were getting into with us.
Yeah, I mean, just to like kind of drive that home, I remember sitting down with you and going over that and realizing like, oh, she's really gonna go over it with me. Okay. I was like, I have plans to go to a museum. Like, okay, I guess we're gonna be here longer than I thought. But no, I mean, I ended up being really grateful that she did because I missed some big bits in there. So.
All right.
Thank you.
Cool. Yeah, thank you.
Thank you.
All right, so thank you very much, Steph. Appreciate you being here with us today. And there we go. So next I'd like to introduce Selma Moreno. Selma is a research coordinator at National Jewish. This is her second year in that role. And in addition to her work in CF, Selma also participates in nonprofit organizations to advocate for underrepresented populations by facilitating workshops to educate and organize these communities. Selma is here today to speak to us about her experiences utilizing resources that help to collaborate with other sites, as well as the benefits of attending RC study team calls. So welcome, Selma.
Okay, cool. I want to start by saying thank you to Alex and Julia for inviting me to be here and share my experience as a newer RC. And I would also just like to start by saying that I'm also not a public speaker. And in undergrad, they required me to take a public speaking class to complete my major. And now I'm wishing that I took it serious. And, some of the, I don't know if this advice is still valid, but, they say, like, if you're feeling nervous to imagine people being naked, and respectfully, I don't want to do that. But on the plus side is that I lost my glasses, so all of you look pretty blurry to me. And so I wanted to begin this presentation with sharing a quote that I found while I was Googling quotes about collaboration that I feel like really embodied a lot of the work that we do. And it's cooperation is a thorough conviction that nobody can get there unless everybody gets there. And I think this really just, again, emphasizes what collaboration is and what it means. And truly, I feel like as research coordinators, we're kind of on the front line of a lot of this collaboration. We're responsible for recruitment. We're responsible for pre-screening and screening. And I think that just as a community of CF ourselves, our CF patients really much come together as well too and contribute. They share their stories. They volunteer to participate in research. Our scientists who come together as well to explore these ideas and, experiment and execute these ideas. So this is truly a big effort on our end. So I'm very new to research. I would say even though I'm It's my second year in this role. I'm still constantly learning. And I'm also new to CF. So in my undergrad biology course, when CF was mentioned in the textbook, it was only mentioned to be a pulmonary disease. And so when I was onboarded onto the NJ team, and learning about CF, I did not realize that it was a multi-organ, genetic disease. And so it was, bittersweet learning about it. It was very interesting. I have a background in biochemistry, so I very much nerded out learning about the molecular function of the CFTR protein. So kind of where my utilization of resources began was with the CF Foundation, and I just really want to give them a huge shout out because they do a phenomenal job of providing information about CF, what it is, even diving into the nitty-gritty science, but also I think they do a really great job of giving you enough information that it doesn't overwhelm you. Okay, so kind of what prompted me to further utilize the resources that is available to us as research coordinators is I jumped on the co-op meeting. As Rachel mentioned before, the cooperative is really a site collaboration type of, goal and journey. And so I did not know that you were allowed to collaborate with other sites. I thought that was not a thing that existed. And basically, I was assigned to be a lead on a study. And although we are a pretty big center, we were kind of struggling with recruitment. So I figured that it would be a good idea to reach out to another site. And at the co-op is when I learned about the Clinical Research Referral Support Program, or the CRISP, as people call it. When I first saw the acronym, it reminded me of the CRISP protein. And so I thought that, I was like, do we work with CRISP too? Anyways, so I kind of came to the CFCRNet because I remember seeing a flow chart of it and seeing like, okay, what are the kind of the things that I need to do? And so basically I used the study site contacts, non-study site kind of flow of this diagram that's listed here. And one of my goals is to also, I'm very passionate about addressing healthcare disparities and also working towards reaching health equity. And so really, I was trying to focus on recruiting patients that kind of meet demographics that would help also fulfill the CFF Foundation of making research more inclusive and more diverse. So, which leads me to my.cff.org. So here's where you can find, based on your co-op region, who is in your co-op region, or you can just search folks. Let me see what I have next. Regional Cooperative Report. So I first started by generating a report to see who is in our co-op region, and kind of from there, I was trying to see like, okay, who would potentially be a site that has patients that may, have demographics that I was intentionally looking for. And I saw that they were not in the regional cooperative list, because then I learned that there is TDN sanctioned sites and that there aren't. But that doesn't mean that participants who attend a CF center who aren't TDN sanctioned they are allowed to participate in research, and that was something that I learned along the way. So because I couldn't find them here, I proceeded to go here. And this was really easy to navigate. Again, this is found at my.cff.org. And here is where I was able to find the contact information from people who work at that site, nurse coordinators, research coordinators, or as well as physicians providers that are at that site. And so I began by emailing the nurse coordinator who works at that center, and she was actually really excited to hear from me and really excited to potentially help some of her patients get involved in our research study. Unfortunately, we were not successful, but that is okay. I think that it definitely opened a door for me, or for us as a team, to establish some rapport and again, collaborate with another site as well, especially a site who may be misses, the opportunities of research because of different factors. Okay, and then I feel like another underrated resource is the research coordinator study calls. I know that sometimes these tend to be a little bit more common if you work on a sponsor industry study. I know they tend to organize the monthly study coordinator calls, but I think that mine, that was not still met monthly for it. So I know that maybe it might not be required for you to attend. I know that my manager doesn't require me to attend them, but she does expect me to attend them. And I do think that you gain so much information from these calls. Sometimes, you jump on, you do a check-in, and then you hop off. And then other times you can really hear people's questions come up. And me, who I tend to be a very introverted learner, so I shy away from asking questions. It's always good to hop on those calls because, there might be a research coordinator who either is a veteran in the game or, newer in the game that may have the same question as you. Or hearing from research coordinators with a lot more experience kind of ask the harder question gives you an opportunity to learn. I know that I had the privilege to work on a study where our lovely Julia was also working on it, and just hearing the questions that she asked the sponsor and even resources that she came up with that she was willing to share was very helpful. And I think as time went by, I definitely started to gain more confidence, which also prompted me to ask more questions and be more present in these research coordinator study calls. And with that, thank you, and I will take questions.
All right, well, first of all, I think, Selma, you don't give yourself enough credit. I know the exact study you're talking about, and you were amazing, and you had some great questions on that call, and so I appreciated the questions that you came up with as well. So please know it goes both ways. But as a newer RC, of all the resources that you did name, which of the one did you find the most useful?
That's a great question. I think that when it came to learning what CF is, and if there was for some reason a point where I had to explain CF to someone, which that's not the case, I'm usually always also learning from patients. I think that mycff.org has a video that was basically explaining CFTR at the molecular level. And because it was also very visual, it definitely kind of, helped me understand the function of the CFTR protein, learn where in our bodies we find CFTR protein and what is happening to that protein in, the context of CF. And I think when it comes to a resource that really helped me in my role as a research coordinator, again, it was my first time ever being in research. I didn't do research in undergrad because I struggled a lot with imposter syndrome, was I think also it was mycff.org, or it might be the TDN that has these summaries of the phases and of the trials, and I found that really helpful too, because I did have one particular participant who was new to research and didn't understand the phases of clinical trials, and I found that really helpful to, give to them, but also summarize. So yeah, and there's definitely resources on CRNet, specifically for research coordinators in terms of the onboarding. And there's one that's particular that summarizes the role of the research coordinator and then kind of goes into highlighting some responsibilities. And I think that my institution does a good job with also onboarding research coordinators. And I know that we have our own documents too, because again, our institution, I think it varies. I found that definitely helpful, at least to understand the role of the research coordinator.
I will second what Julia said, that your questions at RC calls are very much appreciated. In fact, a sponsor told me as such that your questions resulted in resources and potential changes and things like that. So please ask questions on the RC calls. They are helpful. So I have a question for you about how collaborating with RCs in these ways has made you more successful in your role.
Yeah, that's a great question. I think to give kind of a more of a broader type of response, obviously it's going to be very subjective. I think that what really helps me in general is I love to learn. If any of you get the opportunity to take the Clifton Strengths test, you should, because you learn a lot about yourself. And I think that learning those skills also help you collaborate better, especially in a group setting. So if you haven't, ask your supervisor or whoever, and maybe your institution covers it. Who knows? But anyways, I love to learn. And so I think that, what was the question?
How has utilizing these resources helped you be successful in your role as an RC?
Yeah, so as a learner, it makes me very curious. So I like hearing from people's experiences, and that is helpful too. So I think that, because of me wanting to collaborate with other sites, I've learned, that there are TDN sites, there are sites that are not TDN sanctioned. And again, having just chit chats with one-on-ones with more experienced RCs is helpful. One of my colleagues who has been an RC for, I think, maybe 4 years, 3 years, I learned a lot from her, and she's collaborated with other sites from her previous experience, but also with us. And so kind of like knowing the process of it has been helpful as well too. As I mentioned again, Julia being on a study that we were both working on, and hearing her experience also helped me to be like, okay, like I should probably be like focusing on this part.
And what have you learned from collaborating that surprised you?
That we're competitive. No, I'm kidding. No, that truly, I think truly that we love to help each other out. Like, we are not the type of community to gatekeep things. I've never worked in oncology or in research, but I have a friend who works in oncology research, clinical trials, and she was telling me that sometimes they really, especially when they're high enrollment studies, that they really like to go after people. And so we don't focus on that. We really focus on what's the beneficence of our community. And so if that means that, we're not getting points or metrics because we think that it would be better for this patient to go to this site, to have this experience and participate in this research study, is a lot, it fills our cups a lot more. And that is something that I've very much appreciate with being a part of this community. Thank you.
Thank you, Salma.